Hello, a very good morning to one and all. I'm Dr. Shrutika. I welcome you all back to our new YouTube video today. So, like we are into a series of views of Dr. Hahnemann on case taking. So, this is the part 4 of the series that we are into about Hahnemann. So let's get started. So before starting with today's video, let's revise what we did into the previous video. So to get the link of all the videos, and if you're coming up to this video for the first time, so it is better that you go back and complete it part by part so that you can link down all the things and it will be easy for you to connect all the things and understand. So our intention is to understand and not just mug up things which are there. So if you understand things, अगर हम कोई भी चीज अच्छे तरीके से समझ लेते हैं, it becomes very easy to apply. So it is not something we need to remember, memorize. हम वो चीज का concept समझ गए ना. So we are doing nothing but we are just understanding the concepts. What are the different concepts of given by Dr. Hahnemann in with respect to case taking. So what we did in our previous video was about aphorism number 91. We talked about past treatment and recording. So we talked about past treatment and recording. In aphorism 92, we talked about acute disease recording. In aphorism 93, it was private. Aphorism number 94 was about recording of maintaining costs. And aphorism 95 was about recording of long suffering or chronic suffering. So now in today's aphorism, so we'll start up again, not an issue. Yeah. So today's aphorism is about aphorism number 96, that is hypochondriac patient. Now, what is mentioned in aphorism 96 is about hypochondriac patient. So who do we call as hypochondriac patients? Where the patient is giving an over-exaggerated expression. So beside this, patients themselves differ so much in their dispositions that some, especially the so-called hypochondriacs and other persons of great sensitiveness and impatient of suffering, portray their symptoms in too vivid colors. And in order to induce the physician to give them relief, describe their ailments in exaggerated form. So, डॉक्टर को लगना चाहिए मुझे मैं बहुत बीमार हूँ, so doctor should call me first or should attend me first. Or these people have a tendency of being very impatient. The disposition is of very impatient and they portray their symptoms into a very vivid character, expressing them exaggeratedly. बात छोटी सी होती है पर इतनी करके बताते हैं, is known as exaggeration of symptoms. Now, a pure fabrication of symptoms and sufferings. Let me take this ahead. Let me take this up. Okay. A pure fabrication of symptoms and sufferings will never be met with an hypochondriac. तो कोई भी चीज हमें जो hypochondriacs patient में मिलती है, it is always over exaggerated. So it is very difficult to get the pure, the unfabricated, the pure original true picture of the disease. So even in the most impatient of them, a comparison of suffering they complain of at various times when the physicians gives them nothing at all and sometimes quite unmedicinal proves this plainly. So whenever a patient of hypochondriac disposition is coming to us, even if we are not giving the patient per se in a kind of medicine, so even after taking that medicine, the patient will compare. The patient when coming up to us for follow-up में आके कुछ और ही बात करेगा. मुझे ऐसे हुआ, मुझे वैसे हुआ. Why? Because the disposition of the patient is being hypochondriac. So, but we must deduct something from their exaggeration. At all events, ascribe the strong character of their expression to their expressions when talking of their ailments becomes of itself an important symptom in the list of features of which the portrait of disease is composed. So whenever this patient is coming to us repetitively, what we have to understand, what is the pattern of the patient? how is it behaving, how is it talking, how is the personality, how is the overall behavior of the patient in your clinic, maybe in the waiting area. कैसे बात कर रहा है पेशेंट, क्या कर रहा है, we need to understand, we need to observe it. So by this observation we will deduce down our physician's own observation कि हाँ बाबा ये patient hypochondriac है, but this kind of hypochondriac, or maybe this kind of remedy we can think of giving the patient. So it is very important for us, जो हमने पढ़ा है कि observation of physician plays a very important role when we are dealing with hypochondriac patient. What is hypochondriac patient? Exaggerated symptoms, जो exaggeration में बताएगा, इतना सा हो रहा है इतना बताएगा, is hypochondriac patient. So the case is different with insane persons and risky figures of disease. So there's a different concept. One who is feigning to be sick and one who is purely hypochondriac. So hypochondriac patient को तकलीफ होती है. He is having a suffering maybe in a minute or minor magnitude में होता होगा, but he is exaggerating it. But what is it when a patient is feigning to be sick? मैं बीमार ही हूँ, is trying to prove that I am not well. So उसका aspect बहुत different है. This is what Hahnemann has mentioned. So yeah. यार वापस हम बाहर आ गए. Not an issue. We'll start here. Yeah, so aphorism number 97 is about indolent patient. What is indolent patient? Other individuals of an opposite character. So, however, partly from indolence, partly from false modesty, partly from a kind of mildness of disposition or weakness of mind, refrain from mentioning a number of their symptoms, describe them in a vague, undecided terms, or allegations, some of them to be of no consequence result. So these are those kind of patients, जैसे आप यहाँ पे पिक्चर देख रहे हो ना, ऐसे होते हैं, रिलैक्स मस्त रहते हैं अपना. बहुत बड़ी बीमारी हो सकती है पेशेंट को, पर फिर भी कुछ नहीं बोलेंगे, बिकॉज दे कैन बी ऑफ माइल्ड नेचर. भूल जाते हैं मेरे को ये तकलीफ होती है. Partly their disposition is of that character कि not to tell doctors को क्यों तकलीफ देने का. This kind of patients will see in your clinic. I thought it is not important. Let's focus on this symptom first, and then I was going to tell you about I had this problem also. So these kind of indolent patients, not necessarily we can call them. Indolence is nothing but lazy to tell symptoms. हाँ डॉक्टर ये होता है, आप दवाई दे दीजिए. They will not elaborate more. They will not give you many modalities. So maybe in these kind of indolent patients, we have to use clinical repertory. Clinical repertory का use ये indolent patients में होता है. So we as a physician, we should understand कि ये सामने जो patient बैठा है कि वो कौन से टाइप का पेशेंट है. इज ही हाइपोकॉन्ड्रियाक, इज ही इंडोलेंट, उस चीज पे भी अपना केस टेकिंग वेरी होता है. Aphorism number 98 is about record only in patient's language. So now as certainly as we should listen particularly to the patient's description of his suffering and sensations. So basically what essence Dr. Hahnemann has to give in from this aphorism is, as far as possible we have to write the symptoms in patient's own language. अगर पेशेंट बात कर रहा है हिंदी में and we're trying to write it in English to make a rubric out of it, तो वो कभी कभी लिखते समय वो एक्सप्रेशन बदल सकता है. और if the patient is speaking into his local language, if the patient is speaking in Marathi to you, तो वो कुछ मराठी में आपको बोल रहा है और आप उसको कन्वर्ट करने की कोशिश कर रहे हो इंग्लिश में, so that you get a rubric, is not the correct way. So as far as possible, the own expressions of the patients जो पेशेंट बता रहा है और मे बी द अकम्पनिंग अटेंडेंट्स जो बता रहे, इट इज वेरी इंपॉर्टेंट टू राइट it all, especially in case of chronic disease. It is very important to write what the patient is telling. And the investigation of true complete picture and its peculiarities demand special circumspection, tact, knowledge of human nature, caution in conducting the inquiry, and patience in an eminent degree. So whenever we as an homeopaths, we need to be very patient when we are taking our case taking बहुत डिटेल में जाके लेना है. You have to ask about each and every facts so that we reach the right simillimum. What is the what most appropriate remedy indicated to the patient is to be given to the patient. Aphorism number 99. Now, aphorism number 99 is about recording acute case is easy. Now, what are the guidelines given? So, in the investigation of acute diseases or of such as have existed but a short period of time, as is much the easiest for the physician, because all the phenomena and deviations from the healthy state that has been recently lost are still fresh in the memory of the patient and his friends, and still continue to be novel and striking. Right. So still continue to be novel and striking. So whenever a patient is suffering from any kind of acute disease, it is very easy to take its case because patient के घर वाले हैं, बता सकते हैं कि हाउ वाज द पेशेंट बिहेविंग. पर क्रॉनिक केस में भूल जाते हैं क्योंकि सालों साल वो बीमारी रहती है. सो इट इज वेरी डिफिकल्ट to get the true picture of the disease. But in cases of acute disease, it is very easy. The physician certainly requires to know everything in such cases also, but he has much less to inquire into. They are for the most part spontaneously detailed. तो पेशेंट को अगर आप पूछोगे acute disease में, he'll start telling you everything spontaneously. Everything will come within in a very pure form. So it is very easy to prescribe in cases of acute disease. So yeah, so this whole part 4 of case taking was about hypochondriac patient, about indolent patient, and about recording into the patient's own language. And lastly, recording acute case is very easy. So right now we are into a series of views of Dr. Hahnemann on case taking, and this is the part 4 of the series, and we have reached up to aphorism number 99. So if you find this YouTube video useful, do not forget to subscribe to my YouTube channel. Also share it amongst your friends if you find it useful, to share and spread knowledge. So yes, and if you have any queries, any questions, any suggestions, you can always post, comment, or you can also DM me in the mail which is given in bio. So keep learning, keep sharing. Thank you and have a nice day.